Julie Falcon, Chief Advancement Officer at the Beacon, a nonprofit organization formed by the members of the Episcopal Diocese of Houston that serves the Houston homeless community through daily services, meals, civil legal aid, counseling and mentoring, and most importantly, access to housing. Julie, too, remembers a time when the system was much more inefficient than the one that they have today. Well, Julie, we've been walking around and learning about the Beacon, but before we even get into that, just your background and how you got involved with it.
So I've been at the Beacon for 7 years. I'm the Chief Advancement Officer here, and that means I'm basically in charge of all fundraising and communications for the organization. I was working in other nonprofits prior to the Beacon, but when I came to interview, it was immediate that I was just this was my home, this is where I wanted to be.
Wow. And so about 7 years you've been there?
Mm-hmm.
Yeah. And so the evolution of the Beacon from that point to where we are now, because I think you're describing the Beacon really at this point as the front door for just about everything happening with the homeless population in Houston. But how's that evolution taken place under your watch?
Definitely. I mean, since I've been here, it's changed, and even prior to my being here, it was a place where people came to get a meal, but they were coming and getting a meal and leaving. There wasn't necessarily any next step that was being asked of them at that time.
Right.
In 2014, we started organizing with the Coalition for the Homeless and other organizations to really do what we do best. And that is part of that is our day center, where we provide meals, hot meals, and access to laundry and showers. But at that point, we became really the front door for the coordinated access effort. So we wanted individuals to come in, get their meal, have their other needs met, but start thinking about and getting engaged in housing. And now that's more than ever, that's really what the Beacon has been about.
Wow. And we walked through that. The day center's across the street. It's an entire city block. I mean, it's a big operation,
Mm-hmm.
but it starts with people walking in. I mean, it's a really congenial space. People walk in at 7 in the morning,
Mm-hmm. Yep.
and they get checked in. And at that point, you're gathering data. You know who they are, you know things about them, and then they're moving through this system. And maybe you could just talk about the services you're offering, because there's a lot there.
There's a lot there, and in addition to our day center, where again we're serving breakfast now and having a homemade lunch at 11 o'clock. And then they're able to get laundry done and also have access to showers. But we also have legal services. So we have a staff of paralegals and attorneys. They normally work remotely during the week, but on Fridays there's someone there to do intake. So that also leads to housing. Sometimes you can't do much without an ID. IDs
Right.
are often lost or stolen while people are living unsheltered. Our staff attorneys and paralegals help to make sure people have the proper documentation that they need in order for them to be leased up into an apartment. There's a lot of things that need to happen that we lean on our legal team for.
Right.
We also have another pocket, if you will, within our building where people can go in and get their mail. About 500 people get their mail at our facility right now.
Wow, that's their address.
That's their address, and they can be getting stimulus checks sometimes. They've been getting medication. There's
Pause
also
on medication. You're doing healthcare there.
Yes, so there's a building partner, Healthcare for the Homeless, operates the Cathedral Clinic, which has been part of our facility since we were constructed in 2007. So yeah, it's kind of a hub of services, if you will, within that facility.
I mean, I'm just amazed when, as we were doing the tour, I might walk in as a homeless person, and not surprisingly, maybe the only thing I've got are the clothes I'm wearing. And so I walk in, and I can go into a shower stall, I can change into a hospital gown, give you my clothing, give the organization the clothing. I got a really efficient laundry operation. And then I go in and I have a meal. The meal was kind of like one of the healthiest meals I've seen, and tasty. There's a whole rack of spices that came from Spokane, Washington.
I know, I love that. Fun fact, I'll be able to be sure to mention that on my other tours.
Yeah. And then all that's happening, and then all of a sudden my name is called, and those clothes I was wearing 45 minutes earlier are in a neatly folded stack. I take those clothes, I pick up my mail, my phone is in a box that's locked, and it's been charging the whole time. All these things are happening simultaneously.
Right. So we really want to we wanted to, with that shift again and making sure that individuals are coming in with purpose, and the purpose being housing,
Right.
that we wanted to be part of their day. And so they have an opportunity to get many things taken care of while they're there at the Beacon. So, oftentimes people are on the wait list for housing. We don't have enough housing inventory. We have run into challenges as a community having enough housing inventory. We've had hurricanes come through, the global pandemic. I mean, there's just been challenge after challenge where we have had to shift and kind of put a pause on getting people moved in sometimes. But
those hurricanes almost, we've got Katrina early in 20 years ago or so, but Harvey was in 2018 maybe?
2018, yeah.
Yeah, and in some ways the city almost demonstrated what it could do with homeless populations in a quick and effective way. And you've applied some of those lessons with this homeless population in Houston now.
Right. Just as the Beacon has shifted its model of operating, to respond to the different disasters, the coalition and all the work that we did after Hurricane Harvey really was to make sure that those that were displaced were able to find a place to land.
Right. I hear so much about housing being the focus, and that's the track, and talk more about that, but it's not just about housing. I mean, it's about all these things that are in preparation for housing and this track towards housing. And there's the data component. You're gathering all this information, learning about the people, and they're probably so different. For people that don't necessarily know about it, they've got this idea that perhaps we're taking homeless individuals and putting them into housing, and maybe some of the other things going on in their lives aren't being addressed. So we're maybe talking about labeling it for ourselves more housing with help. And that's obviously happening here at your center.
That's what's happening as a community, because the Beacon provides the assessment part, so that very, very first step. We have navigators now that help once the assessment is done and that person is up to the top of the list, the navigation kicks in, and those individuals actually go and they might be meeting this person at the Social Security office to get those documents ready. They're meeting with the landlord. They're going through the lease with the individual. But once that person moves in, other agencies kick in their work and are case managers for that extra help.
And you're working with a lot of agencies in the entire coalition. And how many agencies about?
About 100,
wow.
that are all plugged into the Coalition for the Homeless, the model that we've created for the continuum of care, HMIS. So we're all sharing the same data. Our organization is unique in that we see a lot of individuals each day, but every organization has a strength. And then those that are providing those wraparound services, if you will, once individuals are housed, are doing that important work. So
it's not just putting them in a house and walking away, it's a whole lot more than that.
Homeless individuals or individuals that are experiencing homelessness would be going to one agency and saying, I need a place to stay, and that case manager would get on the phone and start calling to all the different agencies to find out where they could stay, and then that individual might move on to another agency, and that case manager is getting on the phone and making the same phone call to find out where this
didn't have the centralized data, but now you're sharing all that.
Now we're sharing all that, so we're able to see that this person is being supported by this agency at this step in the process.
So before everybody was working together, they're all doing their own thing. Almost a lot of chaos there.
Yes.
You talked about hiring navigators, and we have all these different agencies, but two of them are the city of Houston and the county working together, and they're receiving ARPA dollars. Maybe you could just talk about what are the ARPA dollars and how is that helping in what you're doing right now?
So those are federal funds that came down to the community as part of the COVID response. The first wave of that was the CARES Act funding. Again, the community was able to funnel those funds, but also the city and the county coming together to realize that they could do more together with the funding than separately. So then again, we work with the Coalition for the Homeless to really organize all of that funding and pick where we're going to do the work.
Right.
And we, without sacrificing our mission, we look to see where can we add to this work. And so there are 3 different initiatives with the Community COVID Housing Program, and the Beacon is involved in the Bridge to Permanent Supportive Housing. And that means that we were able to add 7 navigators to our staff, where we had 1 before. Now we have 7 that are, again, leasing up these individuals to get them ready for move-in. So the funding really has made an impact on the community as a whole, but really on our ability to deepen the level of services that we provide to individuals that we see coming through our doors.
That's how some dollars are being spent. The city and county are working directly with you, and I think all cities have those dollars flowing into them. And there's some questions about where they should go. This sounds like a great use. So these individuals, these 7 navigators, are coordinating healthcare benefits. They're getting IDs for people. They're pulling together all the resources they need to have a successful move into housing. And Julie, maybe you could just comment, because of course it's a long term. You're thinking long term. Obviously, everything we've heard is long term. If I saw somebody going into permanent supportive housing, I've heard that the statistics that you have are something like 2 years later, we would still see that those are successfully housed and going well.
Mm-hmm.
Yeah.
And the city leadership can speak more to that, but yes, it's we've seen a good success rate with once people get moved in.
Julie, I arrived last night, and one of the first impressions I had coming into downtown Houston is I really am not seeing a lot of visible signs of homelessness. So now we're here about a block away from our hotel, walked over, and I look around, and you've got these beautiful courtyards. You're affiliated with the Episcopal Church that's been here since, I think, a couple years after Houston was founded, back in about 1830. And it's beautiful, but I'm really not seeing signs of homelessness until I walk into the center, and even then, it's this very smooth operation where people are talking and dining together, and it's just kind of a remarkable thing to see.
Well, yeah, I've not been to your community, so I don't
Right.
have anything to compare to. But yeah, we like to be able to serve our neighbors and those that are hungry and hurting and living unsheltered, and provide a safe space for respite and hope. So there are some days might look different here in downtown.
A good day, yeah.
Yes, in downtown Houston, but there's certainly some individuals that are around, but maybe not as many today.
It sounds like the Beak maybe was one of the first to step up and set their individual agenda aside, because you've been in the business for more, doing this kind of thing for 15 years.
Right.
But about 7 years ago, you kind of shifted gears and worked with this broader vision. How did, from your perspective, how did everybody come together and start working towards this common objective instead of everybody doing their very valuable but separate agendas? Mm-hmm. How did you see that coming together?
I think a lot of that had to do with the leadership from the city at the time, Mayor Parker's initiative to really get us all on the same page, in addition to the coalition, and really providing us with support. So while the coalition is not a direct service provider, they certainly provide each agency with support. It's not a perfect partnership amongst all of us. But I know that, and maybe even given the fact that we've endured some disasters together,
right.
Our CEO, Becky Landis, when hurricanes happen we had a freeze that came through Houston. It was Storm Uri that literally froze the city for 3 days. The city opened a warming center. All of the major CEOs and the homeless service providers, agencies they text each other. Becky's texting with, Tao at Search and Star of Hope, the CEO there, making sure that we're all coordinating our efforts and deploying our staff as appropriate, so that we can be there for the individuals that we see every day.
Wow. And just looking ahead, you're not even necessarily measuring success. I mean, it's an evolution. What you're doing today, which seems spectacular. You're not necessarily saying, if we serve X number of meals today and tomorrow we serve more meals, that's not necessarily a success. You guys are looking at it a little differently and still evolving.
Absolutely. I think, and it's for me, it's like turning a ship. It's a lot of work, but it takes, a little bit every year, and listening to each other, listening to those that we serve, listening to our city leaders, and really just evaluating how we're doing as a community overall.
Wow. It sounds like you've really benefited from leadership coming from the city and just a strong voice on homelessness. They kind of almost gave cover to everybody to come together and see things and work closely together. So that leadership has been here in Houston the last at least 7 years or longer. Julie, one of the maybe greatest frustrations I see in Spokane is the business community is struggling with the homeless population because there's a sense that it interferes with commerce.
Mm-hmm.
And so how do you think the business community is working with the initiatives, what you're doing and the other agencies are doing? How's that working together?
Well, again, the good news is that we have a good rapport with those leaders at the Downtown Management District. Now Chris Larson, I know Bobby Urey just retired.
Yeah.
But it's everyone approaching it is that they want to be part of the solution versus, it being bad and negative. We'd like, how can we be a part of the solution? What can we do to work through this together? So I think that approach from the business community here has been so extremely helpful. And it's like, you try something and maybe it doesn't quite work. They might have added some additional security or some downtown safety guides. Those seem to be quite helpful. But so just trying and learning is always good.
And it seems like you have all come together on this long-term process of, the numbers speak for themselves. Your graphs are going down with the homeless population and everybody else's, for the most part, look just the opposite. And you have the lowest per capita homeless population of any major city in America. So the program speaks for itself, but you're not really relying on enforcement. We see a lot of knee-jerk response, like we see an encampment downtown, or we see, the kinds of things that might interfere with commerce. And a lot of the reaction is, let's let the police do their jobs and just clear that out. But it doesn't sound like that's an approach taken here.
No, the outreach teams here, they will work with encampments, and we have they'll have certain teams that will go in and help to find housing for the individuals that are living in those encampments, so they have an immediate solution for them. It's not just move on. We shifted everything during the pandemic for the first few months in March of 2020, where we were doing outside meal delivery, and shifted back in September. There's been a lot of change, so we can turn on a dime.
Wow. We're sitting right now in the bride's room at the Episcopal Church, which is a really nice setting.
Christ Church Cathedral, yes.
Christ Church Cathedral, which just sounds like it has a ton of history. It's just beautiful. And this is the bride's room, so this is what it looks like it does. Are these real?
Maybe there was a wedding. I don't know. No.
Beautiful too. But you have this relationship with the Episcopal Diocese, and that's been really integral to what you've been able to do. And maybe you could just talk a little bit about that.
Yeah, so they're actually the ones that started the Beacon. Christ Church Cathedral did, and they've had a relationship with helping individuals that have been experiencing homelessness in the downtown area for centuries. Since they've been here in, I think, 1839, the church started. So they had different initiatives that were helping those that were hurting, and then that have spurred into new nonprofit organizations that are still around. But in 2007, when they were starting to vision what they wanted to do with the block next door, the parishioners at the time went out and spoke to individuals that were living on the streets of Houston and asked them, what is it that you need? What can we do to help? And they said, we would love to have a place where we could get services on the weekends. In 2007, prior to, Houston was not a vibrant city where people were living and working all 7 days a week. Now it is. And so they wanted a place that they could go on the weekends, and they also wanted a place where they could get their clothes cleaned. So it's just been a wonderful partnership, because we're continuing to help those in need. And then the churches, again, they've been doing it forever.
So it's a constant evolution for you guys.
Yes.
If you had to guess, what do you see as the next steps, or what's kind of your horizon look like right now strategically?
We have a special task force made up of some of our board members and ex officio members that are looking at our future and trying to determine what the Beacon will look like in 2025. So we're scanning the landscape of services now in Houston, and we're doing some travel outside of Houston to see where can we evolve from here.
Wow. And the church stays involved. We met Deacon Barclay earlier. He's the standing chair of your board.
Yes.
And so that relationship is really solid.
Absolutely.
Wow.
He's the face of our work.
Yeah. And then as you look and hear about what other cities are experiencing, and I don't know, you're probably not looking at the graphs as closely as I am, but when I look at the graphs, like I said, Houston's going that way and everybody else is going that way. For those cities where the graph is going the wrong direction and maybe things aren't working quite so well, what would be your biggest advice to someplace like Spokane?
I guess just spend time listening and learning from one another, and again deciding on how each entity can be part of the solution versus pointing fingers, I think, or trying to maintain so much of the work that you do in a silo. You're going to be so much stronger if you work together.
Julie, you've been here 7 years doing all this. What are you most proud of?
I am most proud of just the way that the Beacon has evolved as an organization to really, across all of our programs, get stronger. Our frontline staff are amazing through the pandemic. They just, were here every day doing the hard work. So that, I would say, would be just the part that makes my job so easy as a fundraiser and communications person. To be able to share the good news about that.
Just walking through the facility really lifted me up. There's a lot of positive energy there.
Good.
I guess I'm going to go across and have lunch. I get to meet a gentleman named Jerry.
Jerry Hamilton, yes. So I met Jerry a year ago, and he has had quite the journey. I would say that Jerry is also one of our strongest public relations representatives for the Beacon, because he came to the Beacon and received many of our services, and is now doing very well. And he can identify individuals that are maybe out on the street here or riding the Metro Rail, and he can see that they were in a similar position or in a similar position that he was, and he tells them, go to the Beacon. They'll be able to help you. So he's a really nice guy.
Great. Well, I look forward to that. I saw the meal being made. I'm looking forward to that too.
Yeah.
Food looks good.
Yes. Awesome.
Well, Julie, I'd like to say thank you. I'm just astonished at the amount of time and effort that you've already put in talking to me and explaining what's going on in Houston. And maybe I'll be back in a few years bringing some good news and saying, yeah, we did a lot of the things you told us. So just thank you so much.
Well, you're welcome anytime. We love showing off our operations and bringing visitors in. So you're always welcome.
Thank you.